1. Political scientist Shanto Iyengar describes news stories that commonly frame social issues from a personal perspective. In these frames, readers are left to conclude that social issues such as poor health, unemployment, and poor housing are the result of poor personal choices. Subsequent research has shown that personal responsibility news frames affect how the public and public policy makers see and view social problems. If we see social problems mainly as the outcomes of personal behaviors and decisions, we dismiss societal causes and solutions. We wanted to share examples of a personal responsibility frame and a social responsibility frame to help you see the differences between the two.
We've seen and heard a lot of headlines about troubling health disparities around COVID-19. Let's look at a story that reports on these and unintentionally leads us to understand them in a particular way. Here we learn that Black, Asian, and other minority ethnic groups in the UK make up 3 times more COVID-19 patients than their proportions in the population, and their cases are more serious. That's disturbing data. In response, your question might be, what can we do? The story quotes a health expert. He points out that South Asians live in more deprived areas. They are more likely to have secondary health conditions like diabetes and heart disease. They also tend to live in multi-generational households. Where does this leave us? Do ethnic minorities choose to live in deprived areas? Why don't they eat better and exercise more? Why do they end up in such cramped housing? These why questions are left unanswered, including their connection to COVID-19, policies around immigration, unequal access to jobs, and access to quality treatment for ongoing health conditions, including better equipped hospitals for COVID-19 treatment. Without this information, we're likely to fill in the blanks with our own guesses and assumptions. We're left to believe that all these factors are somehow the individual's choice, or perhaps a natural condition of the society we live in. With this personal responsibility frame, inequities seem impossible to address.
I just want to add here that there is no one news organization that gets these stories right. Even some of the most prestigious news outlets get the story wrong. As a news consumer, it's smart to think critically about coverage. Is the story answering enough of the why questions that emerge? This next example addresses the same subject, racial disparity of COVID-19 patients and deaths. Here, the journalist goes much deeper into public policy and social structures that give rise to racial disparity in COVID-19 deaths. Specifically, African Americans are less likely to have health insurance, often denied testing and treatment because of racial bias, and they disproportionately hold jobs that can't be done from home. The strongest point made in this story is the historical context. For example, redlining practices, which started in the 1930s, have a legacy of segregation that has circumscribed many African Americans in substandard housing and in neighborhoods that don't have grocery stores or safe places to walk and exercise. This has led to disproportionate rates of diabetes, asthma, and hypertension, the very underlying conditions that make people more vulnerable to COVID-19. In this story, we see the direct connection between public policy, social structures, and poor health outcomes and mortality. I would add that even this story could have gone further in answering the why. For example, why are African Americans less likely to have health insurance? And why are they disproportionately holding jobs that can't be done from home?
Right now, we see the world changing rapidly around us. We're faced with crucial life or death decisions. It's especially important to pay attention to the information we take in. Notice where a news story starts and where it stops. What questions does it leave in your mind? What ideas does it plant subconsciously? Then look for news that gives more context. What shapes vulnerability to COVID-19? What are the institutional actions that might give favor to some groups over others? These are things we can do something about. We can push for better policies or press institutions to be more fair in their practices right now. We can think about building a world beyond COVID-19 that is better than the one the virus is forcing us to leave behind, and at the same time, exposing as deeply inequitable.